same things noted, that they're clear and no adventitious breath sounds. After this, we're going to also listen to see if we can hear a murmur or anything. So I'm going to have you bend forward slightly. Thank you. And then go ahead and you can relax your arm. And then go ahead and inhale and exhale. Okay, and there's no notable murmur when listened to. Okay, so next we're going to go ahead and have you, we're going to do upper extremities while you're still sitting. So let's go ahead and stick out both your arms for me. This is going to be the same as everything else. We're going to constantly look at skin for any sort of abnormalities, breakdowns, scars, any sort of lesions, anything, dryness, which her hands are a little dry right now. We're going to look at fingers. We're going to check capillary refill, which is less than 3 on both hands. We're going to check skin turgor. No tinting noted. Then we're going to go ahead and we're going to check our pulses, our radial, brachial. Okay, we're also going to feel for our lymph nodes in these areas as well. Which, any soreness? Nope. No soreness, nothing noted. Then we're going to go ahead and we're going to look at joints in hands and fingers. And then I'm going to notice if she says anything about pain. And then if anything looks swollen or any joints deformed or anything like that, which she is just fine. Okay, we're going to do range of motion to both these wrists. So I'm going to have you down and up, out to the side, back in. Very good. Go ahead and squeeze both my hands. Very good. And then we're also going to go ahead and look at her arm range of motion. So we're going to go ahead and bring those straight up and back down. Very good. And then go ahead and stick them straight out. And we're going to flex and pronate and supinate. And then we're going to bring them in and back out. And then against resistance. So try and pull back in. And then push against me. Very good. Okay, so that's our upper extremities. Also note as you're feeling the extremities if there's any sort of coolness, the way the temperature feels as well. So her hands and everything were nice and warm to touch too. So now I'm going to go ahead and have her lay down. You can lay long ways like this. Yeah, like that. Alright. Okay. Alright, so with this, I'm going to not want to pillow under her head for the first part. I'm going to be looking at her neck again. Everything looks midline, symmetrical. I'm going to have her move her head to one side and to the other. Checking to see if I notice any noticeable pulsations in her neck, which she does not have any. And then we're going to go ahead and listen to her heart. Okay, and then we're going to listen with the bell of our stethoscope. With that, we're listening in 5 different spots, and first we're listening for the S1, S2, which is normal, and then we're listening for any abnormal heart sounds. Next, we're listening to our apical rate for 20 seconds, well, 15, and then we'll multiply for this assessment. So we got about 14, and then we're going to multiply that by 4, but normally you're going to want to listen for the full 60 seconds. So after this, we can also feel underneath to check to make sure that we don't feel any pulsations, thrills, anything like that as well, which she doesn't have any. So, okay, so that's our heart. Then we're going to go down and we're going to go ahead and look at her abdomen. I'm going to pull her shirt up for this. So same thing, same as all the rest of the skin. We're looking for anything that looks abnormal. In this case, also, do we see maybe any signs of a hernia, anything like that? So we're going to look for anything that's protruding, pulsing, anything abnormal in the abdomen. For her, she has a nice flat stomach. Everything looks symmetrical. So we're going to go ahead and now that we've done inspection, we're going to go ahead and listen to her stomach. We're going to listen in all 4 quadrants. We're going to start in the right lower quadrant. Then we're going to also listen to her aorta while we're down here. Okay, so we're able to listen to that as well. Her bowel sounds are all active in all 4 quadrants. So next, after that, we're going to go ahead and percuss her stomach. We're going to do this in a zigzag pattern, 3 in each quadrant, starting in the right lower again. Perfect. All that looks normal. So while I have her down here, I'm also going to go ahead and do some range of motion with her legs laying flat. Go ahead and cover that. Yeah. Okay. So I'm going to have you bring up this leg, straight back, and back down. And same with this one. And back down. And then we're going to go ahead and bring it out. And back over. Down. And same with this one. Out. And over, and back down. And then with all these range of motion exercises, we're going to want to watch to see if she grimaces, if she complains of pain, if she's doing most of it herself, or if I'm having to perform most of the range of motion exercises. So after that, we're going to go ahead and have you sit up. As well as every time I'm having her sit down, lay down, anything like that, I want to also watch her face, watch how she does this, and see if there's any difficulty. Next, we're going to look at her lower extremities. She's pretty well covered right now, so I'm going to talk about most of this assessment. So it's going to be the same as upper extremities. We're going to look at her skin. We're going to see that everything is intact, that she doesn't have any open sores. We're going to look for edema in the lower legs. We're going to look dry skin. We're going to notice hair. Does she have an irregular hair pattern growing in her legs? We're going to check capillary refill in toes, same as in the upper extremities. We're going to feel all our pulses. We're going to feel the pedal, popliteal, and tibial pulses. We're going to note any irregularities in that. And then I also like to do it at the same time to notice if one feels different than the other. If she is edematous, we might also mark these so that way we can keep a better idea of them. And if we have to use a Doppler, we'll also do that and note that. But with her being nice, young, and healthy, should just be able to palpate them. We're going to do a couple of tests. We're going to test Babinski. Let me get my thing. Okay, so I'm going to have you stick your foot up. I'm going to go up and around and note that her toes are going to curl in. Very good. And her toes are going to curl in, which is the right sign. Okay, I'm also going to have you take your heel and rub it down your shin. Okay, good job. Very good. And then we're also going to test her reflexes. Okay, very good. Okay, then we're going to also test range of motion in her toes and her ankles. So, yep, flare out, curl in. And then with her ankles, bring them out, back in, point down, back up, then to resistance, and back. Very good. Okay, and then we're also going to test resistance to the knees as well. So go against the knee and back down. Very good. Okay. Okay, so next we're going to look at just some different neuro stuff. So we're going to use our cotton tipped applicator, and I'm going to touch different parts of her body to see if she can tell me where we're doing that. And she's going to do all this with her eyes closed. I'm also going to get my key. Okay. So with eyes closed, you're going to tell me where I'm touching.
Right cheek.
Okay.
Left cheek. Left arm. Right arm. Left leg. Left leg. Lower leg. Right foot.
Very good. And with her eyes closed, we're also going to see, I'm going to put two different objects into her hand, and then she's going to see if she can tell me what it is without looking and just using one hand. So just this hand, tell me what that is.
A coin.
Very good. Back to me. And then
key.
Very good. Okay. And then also with her eyes closed, I'm going to have you stick your hands out. And I'm going to be moving a finger, and I'm going to ask her to tell me which way I'm moving the finger. So we're starting this hand, okay?
Mm-hmm. Up.
Good.
Down.
Very good.
Down. Up.
Very good. Okay, and then you can open your eyes. And then we're also going to stick your hands out. And then we're going to go back and forth. Really good. She's able to do this together at the same time. Okay. Next, I'm going to have you stand up. Okay, and we're going to do a few things while she's standing. So I'm going to have her walk. I'm going to come this way so you can see. You can come over here. Okay. Just walking towards me, and then go ahead and walk away from me, and then turn around. And you're going to walk a couple steps on your toes. And that's good. And then on your heels. Okay. And then we're going to do the Romberg test. I'm going to stand close to her for that. And for this, it's going to take about 20 seconds. She's going to keep her eyes closed and her arms up. We're going to watch to see if she sways. And I'm going to stand here just in case she needs me. Okay, perfect. So you put your arms down. So that's good. Also, while she's standing, we're going to do range of motion for her spine. So I'm going to go ahead and have you bend forward and back up. And then side to side. Very good. Okay, and then I'm going to have you turn back around. We're going to do some low knee dips. You can grab the foot of the bed.
Oh, okay. Mm-hmm.
Okay, and then you're going to do one leg at a time. And you're just going to kind of bend down with one knee, back up, and then switch. Very good. So you can sit back down. So that's the overall head to toe. There's several other things that would go on during this. We would have talked about pain. We would have taken vital signs. I just would have noticed several things. If there was an area that had an abnormal finding, we would also look further into that. And we can gather other data from lab results and CTs and everything else. But we want to note the areas that are abnormal so that we continue to focus on that part of the assessment throughout whatever shift it is. And then we're just going to also, with all these things, we're doing the same stuff throughout the different systems, a lot of it, the range of motion, everything, but we just want to note how each system performs and how she's tolerating everything. But overall, that should be it.